Bismillahirrahmanirrahim. The quote for today is have more than you show, speak less than you know. Today we will be discussing tuberculosis. That is a major public health challenge that continues to affect millions globally. TB remains one of the top infectious killers worldwide with significant health and economic effects, especially in high burden countries like Pakistan. Our discussion will cover the epidemiology, clinical aspects, prevention, and management of TB with a focus on public health intervention strategy. I am Dr. Muhammad Abbas Gill, PGR in Community Medicine, and I am giving this presentation under the kind supervision of Professor Dr. Saira Afzal. Now, the epidemiological triad of TB. TB can be understood through the epidemiological triad, that is agent, host, and environment. The causative agent is Mycobacterium tuberculosis, that is an acid and alcohol-fast bacillus that primarily affects the lungs but can spread to other organs. The host factor influencing susceptibility include immune status, age, and underlying conditions such as diabetes or AIDS. Environmental factors play a crucial role in TB transmission. Crowded living conditions, inadequate ventilation, and poverty create an ideal setting for the spread of tuberculosis. Addressing these factors through improved housing, nutrition, and access to healthcare are essential for TB control. Now, the incubation period and the period of communicability. The incubation period for TB, which refers to the time from exposure to the development of infection, typically ranges from 2 to 12 weeks. However, not everyone exposed to TB will develop active disease immediately. The period of communicability begins with when the person has active pulmonary tuberculosis, particularly when they have a persistent cough that spreads bacteria through respiratory droplets. Individuals with untreated active TB can spread the disease to others, making early detection and treatment critical in the in the uh, in the controlling of the transmission. Now, the classification of tuberculosis. It can be in two forms, that is latent tuberculosis infection and active TB disease. In latent tuberculosis infection, the bacteria remain dormant in the body without causing symptoms, and the person is not contagious. However, if the immune system weakens, the latent TB can progress to active disease. In active tuberculosis, symptoms such as persistent cough, fever, night sweats, and weight loss appear, and the person becomes contagious. Distinguishing between these two forms is crucial for appropriate management and preventing disease progression. So coming towards, or it progresses from latent tuberculosis infection to active tuberculosis. In latent tuberculosis infection, as I have already said, that it has no symptoms and not contagious. However, when the person's immune system weakens, it can be transformed into active tuberculosis. No, the difference between the latent tuberculosis infection and the person with the TB disease is that in latent tuberculosis infection, it has a small amount of tuberculosis bacteria that are alive but inactive. While in TB disease, it has a large amount of tuberculosis bacteria in the body. Latent tuberculosis infection cannot spread to others, while TB disease can spread. Latent tuberculosis infection does not, in this, the person does not feel sick, but may become sick if the bacteria become active in the body. While in TB disease, the person is sick. In latent tuberculosis infection, there is a positive tuberculin skin test or the blood test indicating TB infection, and it should be considered treatment for latent tuberculosis infection to prevent tuberculosis disease. So there's another classification based on the site of the tuberculosis infection. The pulmonary pulmonary disease, that is the primary disease, or it can also be spread to others and leading to the secondary disease. While the extrapulmonary tuberculosis infections, the number one is the lymph node tuberculosis, then the pleural tuberculosis, TB for upper airways, skeletal tuberculosis, genitourinary tuberculosis, meningeal tuberculosis, pericardial, gastrointestinal, and tuberculosis meningitis. Now, the primary pulmonary tuberculosis. It occurs after initial exposure, leading to formation of bone complex consisting of a subpleural lesion and involved lymph nodes. It may remain latent for or progress to acute disease, while the secondary pulmonary tuberculosis results from reactivation of latent tuberculosis infection, typically in the apex of the lung, where granulomas place to form larger areas of consolidation with caseating necrosis. Then is the progressive pulmonary tuberculosis when primary or secondary tuberculosis fails to heal. it can lead to widespread dissemination through lymphatic channels and bloodstream, causing miliary tuberculosis or cavity lesions. The most common early symptoms of pulmonary tuberculosis is a persistent cough that lasts for more than 2 weeks, which may become productive with blood-streaked sputum. Fever is another common sign, often low-grade and more prolonged at night, accompanied by night sweats. Patients frequently report unexplained weight loss and persistent fatigue, which can significantly impair their daily activities. TB can also be present in extrapulmonary sites, affecting areas such as lymph nodes, bones, and others, and causing their symptoms related to the system involved. Now, the World Tuberculosis Day is celebrated each every year on March 24. Now, the high risk groups that are vulnerable to tuberculosis infection and disease are individuals with a human immunodeficiency virus have a significantly increased risk due to their weakened immune systems. The elderly, due to age-related immune decline, are also vulnerable. People with chronic diseases like diabetes have a compromised immune response, making them susceptible to infection. Immunocompromised individuals, such as those on long-term corticosteroids underlying chemotherapy, faces a higher risk of disease activation. Now, contact tracing plays a vital role in controlling tuberculosis by identifying individuals who have been in close contact with an infected patient. Once identified, the risk level is assessed based on a duration and proximity to the contact, with household contacts being at the highest risk. Screening tests such as tuberculosis skin test and IGRA, that is interferon gamma release assay, are conducted and preventive treatment is offered to those at risk. Surveillance efforts involve collecting data on new cases, monitoring treatment adherence, and assessing trends to guide public health policies. When left untreated or inadequately treated, TB can lead to severe complications. Progressive lung damage can result in respiratory failure and fibrosis. In some cases, the bacteria spread through the bloodstream, leading to miliary tuberculosis. It is a disseminated form that affects multiple organs. Tuberculosis meningitis is another serious complication causing inflammation of the brain and spinal cord, which can lead to neurological deficits or death. Pleural effusion, the accumulation of fluid in the pleural space, is another manifestation or the complication of tuberculosis. Now, coming towards the prevention of airborne infection related to tuberculosis. Preventing TB requires a multi-pronged approach: respiratory hygiene, including covering mouth when coughing, and ensuring proper ventilation reduces transmission. The use of N95 masks by healthcare workers and surgical masks for patients help contain the spread. Isolation of patients with active TB, especially in hospitals and crowded environments, is crucial. Education and awareness programs in the community help people recognize symptoms, seek treatment on early basis. No, the diagnosis of TB relies on several methods. Sputum culture remains the gold standard, offering definitive diagnosis, but it takes weeks. Rapid diagnostic tests such as Gene Expert provide faster results and can detect lung drug-resistant strains. Chest X-rays help identify lung abnormalities and are often used for screening. Early diagnosis is critical to prevent complications and reduce transmission. Now, coming towards the vaccination, BCG vaccination, that is Bacillus calmette urine vaccine, is the only available vaccine for tuberculosis. It is primarily used as preventive measure in newborns and children, offering protection against severe forms of tuberculosis such as tuberculosis meningitis and miliary tuberculosis. The vaccine does not prevent primary infection. I repeat, the vaccine does not prevent primary infection or reactivation of latent TB, but significantly reduces the risk of severe complications. BCG is given at birth in high burner countries like Pakistan, and it is also included in the EPA schedule of Pakistan. It is given at birth, where TB exposure is common. The treatment for tuberculosis involves multi-drug therapy to prevent resistance and achieve cure. The standard regimen includes isoniazid, rifampicin, pyrazinamide, and ethambutol for 6 months. Adherence is crucial to prevent drug resistance, which can lead to multi-drug resistant TB, requiring longer and more complex treatment. Directly absorbed therapy is a widely used strategy to ensure patients take their medications correctly. These are the classifications of first line, second line, and novel generation anti-tuberculosis drugs. The second line antibiotics are ethionamide, pyrithinamide, cycloserine, trazodone, and others. Now, the directly observed therapies. Directly observed therapies, that is also known as door therapy, it ensures that patients adhere to their treatment regimen by having a healthcare provider observe them taking their medications. This approach improves treatment outcomes, reduces the risk of drug resistance, and empowers patients by offering continuous support. Community involvement in door programs foster collaboration and accountability. Now, tuberculosis in pregnancy. Tuberculosis in pregnancy presents unique challenges as it can have serious consequences for both the mother and the baby if left untreated. Early diagnosis is crucial because symptoms such as fatigue, weight loss, night sweats can often be mistaken for normal pregnancy-related changes, leading to delays in treatment. Pregnant women with TB are at a high risk of complications including preterm birth, low birth weight, and increased maternal mortality, particularly in cases of untreated or drug-resistant tuberculosis. The good news is that tuberculosis treatment during pregnancy is both safe and effective. The standard first-line anti-tuberculosis drugs, including isoniazid, rifampicin, ethambutal, and pyrazinamide, are generally considered safe for use during pregnancy and should be initiated as soon as possible to prevent complications. However, streptomycin should be avoided due to the risk of ototoxicity in fetus. No, WHO response and NTB strategy. The Global Tuberculosis Report 2024 by World Health Organization provides insights into the global TB situation, tracking progress and challenges in TB prevention, diagnosis, and treatment. It emphasizes the need for continued efforts to meet global targets and improve access to care for affected populations. Now, coming towards the key highlights of tuberculosis profile in Pakistan. In Pakistan, there are 5 lakh and 10,000 new TB cases emerging each year. The incidence of tuberculosis is 260 cases per 100,000 population annually, and there are 15,000 developing drug-resistant tuberculosis every year. Pakistan is ranked fifth among B high-grade, high-burden countries worldwide for the burden of tuberculosis, and it accounts for 60% of the tuberculosis burden in WHO Eastern Mediterranean region. Pakistan is ranked fourth highest prevalence of multi-drug resistance globally. Now, the TB, and this is the TB end strategy at a glance. The WN TB strategy aims to reduce tuberculosis incidence by 80%, TB deaths by 90%, and eliminate catastrophic costs for TB affected households by 2030. It emphasizes universal access to care, people-centered approaches, multi-sectoral collaboration to combat TB globally. This strategy encourages adaptation to diverse country settings to ensure effective implementation. Now, these are the estimated number of incident TB cases in 2023 for countries with at least 100,000 incident cases. Now, the Provincial TB Strategic Plan 2024 to 2026. The Provincial TB Strategic Plan 2024 to 2026 aims to strengthen TB control efforts through a comprehensive and multi-sectoral approach. The plan focuses on 4 key areas, that is prevention, diagnosis, treatment, and management. In terms of prevention, the strategy includes expanding the coverage of vaccination program and implementing targeted interventions for high-risk groups, uh, such as those at risk, like the households or the healthcare workers. TB control program. The TB control program Punjab under the Primary and Secondary Healthcare Department aims to achieve universal access to TB diagnosis and treatment. Its key focuses areas are diagnosis, treatment, and prevention, capacity building and advocacy, data surveillance, and monitoring. The achievements are TB treatment success rate greater than 94%, screening of more than 8 lakh individuals in 2021, and free treatment for tuberculosis and drug-resistant tuberculosis cases. Now, the Provincial TB Control Program Punjab. Its goals are to achieve TB elimination by improving diagnosis, treatment, and prevention efforts, ensuring universal access to care and engaging communities. It achieves high treatment success rates, expansion of diagnostic facilities, including gene expert and microscopy labs, and enhanced public-private partnerships. Pak- uh, uh, the key stats given by the Provincial TB Control Program is that 60% of Pakistan TB burden, 558 treatment facilities, and thousands of healthcare providers are engaged. The future focus is on strengthening surveillance, integrating technology, and enhancing outreach efforts. No, these are the components of TB control programs that are diagnostics, advocacy, that is print, electronic, and social media campaigns. Then is the public-private partnership that is involves GP clinics, NGO-run hospital, private hospitals, and parastatal hospitals. Then is the treatment, active case finding that is through mobile chest cams using artificial intelligence X-ray units. And then is the TB HIV co-infection, HIV screening of registered TB cases at all TB management units. Then is the other empowering change, National TB Strategic Plan for 2024 to 2026, that is unveiling at dissemination event. It occurs on January 2024. The National TB Strategy Plan 2024 to 2026 aims to accelerate efforts to reduce TB burden in Pakistan through improve diagnosis, treatment, accessibility, and multi-sectoral collaboration. Its goal is to reduce TB mortality by 36% by 2026. The event reviews that dissemination event chaired by national health leaders with participation from World Health Organizations, United States Agency for International Development, and provincial health departments. It is a collaborative approach that emphasizes on multi-sector partnership for TB eradication. The strategy focuses on strengthening healthcare systems, improving diagnosis, and expanding treatment coverage. Then is the Pakistan Tuberculosis Roadmap overview fiscal year 2024 that is given by USAID. The USAID Pakistan Tuberculosis Roadmap 2024 outlines strategic actions to reduce tuberculosis mortality and improve diagnostic treatment and prevention through strengthened healthcare system and partnerships. The goals and objectives is to reduce the TB mortality by 35% by 2026, increase TB case notification, and strengthen health system for better TB management. Its achievements are that expansion of diagnostic services, improved treatment success rates, and enhanced engagement with private healthcare providers. The key stats given are that $40 million are allocated, significant rise in drug-resistant TB treatment coverage, and increased preventive therapy uptake. The future focus is to strengthen healthcare governance, community-based intervention, and public-private partnerships. The next is the WHO key facts about tuberculosis. There are about 1.25 million deaths, including 161,000 among people with HIV in 2023, and TB is the leading cause of death from a single infectious agent, surpassing COVID-19. 10.8 million cases in 2023, 6 million men and 3.6 million women, 1.3 million children. TB is present in all countries and at all age groups, but it is curable and preventable. Drug-resistant tuberculosis. Multi-drug-resistant tuberculosis remains a public health crisis. Only in 2 in 5 affected people assessed treatment in 2023. Funding needs. $23 billion annually are required to meet the 2027 global TB targets. Global efforts. 79 million lives saved since 2000 through TB interventions. Anti-TB by 2030 is a key United Nations Sustainable Development Goals. The management and WHO recommendations. Effective management of tuberculosis requires a multidisciplinary approach that addresses both medical and social aspects of the disease. A successful TB management strategy involves 4 key components, that is a multidisciplinary team, an integrated approach, patient-centered care, and community engagement. Now coming towards the recent updates. The first recent update is about the rapid TB drug resistant detection using Raman spectroscopy and artificial intelligence. It is a wonderful innovation. Raman spectroscopy analyzes TB samples, biochemical composition, and neural networks process the spectral data to detect resistance, offering a fast, cost-effective alternative to traditional methods. It detects TB drug resistance without lengthy culture incubation. It has over 98% of accuracy in distinguishing resistant versus susceptible strains. It is and affordable with portable and AI. It is an AI-driven analysis which uses Raman spectra that identifies resistance patterns. This is the flowchart diagram of Raman spectroscopy that how it works. Then again, there is an wonderful innovation that's early detection of tuberculosis using artificial intelligence-based cough analysis. The artificial intelligence system analyzes smartphone recorded cough audio using machine learning models to detect tuberculosis specific patterns, providing rapid and accessible screening. It detects tuberculosis within 15 seconds using smartphone recorded audio. High accuracy, it achieves 88% accurate, exceeding WHO screening test requirements. Global dataset, it is trained on 7,24,096 964 cough samples from 7 countries for broad applicability. AI integration, it combines 2D CNN and XG boost models for accurate detection. It is easily deployable via mobile webs for use in resource-limited areas. This is a picture of one of the apps that is AI-based cough analysis. There are the names of other apps that are works on the same frame. That is TUSSIS, TUSIS, REST app, and Hive AI. Now coming towards the MCQ session. First MCQ is a 35-year-old woman living in a densely populated urban area reports a chronic cough, intermittent fever, night sweats, and significant weight loss. Photon smear microscopy is positive for acid bacilli. Which public health measure is the most immediate priority to prevent the spread of tuberculosis in her household? Whether administering BCG vaccine to her children, initiating directly observed therapy for the patient, conducting community-wide health education, providing prophylactic antibiotics to household contacts, or improving the nutrition status of the family members. Which is the correct option? A, B, C, D, or E?
B.
Yes, it's B, initiating dot for the patient. Second MCQ is a 60-year-old man with latent tuberculosis infection becomes immunocompromised after starting chemotherapy for her cancer, which is the most likely outcome if latent tuberculosis infection remains untreated. By the development of pulmonary fibrosis, progression to active tuberculosis disease, complete spontaneous resolution, chronic bronchitis with recurrent infections, or pneumothorax due to cavity lesions. If the latent TB tuberculosis infection remains untreated, it will progress to active tuberculosis disease. So the B is the correct option. Third MCQ is a TB control officer is evaluating the effectiveness of recent interventions in a rural community. The program's main goal is to prevent transmission. Which intervention directly targets to the mode of transmission for Mycobacterium tuberculosis? Whether nutrition supplementation for malnourished children, routine vaccination with BCG, installing ventilation systems in overcrowded areas, monthly health checkups for early diagnosis, or mass screening with chest X-rays. The intervention that will be helpful for halting the transmission of Mycobacterium tuberculosis will be ventilation system for overcrowded areas. So C will be the correct option. Fourth MCQ is a public health worker conducts contact tracing for a confirmed pulmonary tuberculosis patient, which factor increases the risk of TB transmissions to household contacts. Whether use of oral medications by the index case, poor adherence to the treatment by the patient's history of BCG vaccination, absence of drug resistance in tuberculosis strain, or diagnosis of latent TB in patient.
B.
Yes, it's B. Poor adherence to the treatment. Coming towards the fifth MCQ, a newborn in a TB endemic country receives a BCG vaccine, which is the primary benefit of this vaccination. Whether preventing all forms of tuberculosis, providing lifelong immunity, reducing the severity of TB meningitis, and MBD tuberculosis, preventing the latent TB infection, limited TB transmission risk.
C.
Yes, it's C. It reduces the severity of complications, that is, tuberculosis meningitis, developing into miliary tuberculosis. Sixth MCQ is a national health policy team is strategizing to achieve the NTB strategy targets within a high TB burden country. While reviewing interventions, they noticed limited success despite widespread use of conventional diagnostic tools and a moderate treatment success rate. Which integrated approach would most effectively align with both our goal target for reducing TB mortality by 95% by 2035 and improving the TB case detection rates, whether increasing annual vaccination campaigns for TB-prone populations or expanding the use of chest X-ray in rural health centers, implementing community-based screening with rapid molecular diagnostic tests, mandating hospital-based isolation of all suspected TB cases, or developing new antibiotics for the first-line treatment.
C.
Yes, it's C, implementing community-based screening with rapid molecular diagnostic tests. Seventh MCQ is a recent initiative integrates AI technology for TB diagnosis. A smartphone-based tool analyzes a patient's cough sound to screen for TB. Which benefit does this innovation primarily offer? Whether increased sensitivity over sputum culture, faster, more accessible screening in low resource settings, complete replacement of traditional diagnostic tests, prevention of drug-resistant TB, or enhanced vaccination coverage.
B.
Yes, it's be faster, more accessible screening in low resource settings. Eighth MCQ. A 55-year-old man diagnosed with multi-resistant tuberculosis has a history of incomplete prior treatment due to medication side effects and poor follow-up. He now presents with severe symptoms and extensive lung involvement. Consider Considering global recommendations, which comprehensive strategy will best optimize his treatment outcome and prevent further drug resistance? Whether intensifying isolation protocols and starting a second line single drug therapy, or whether administering first line antibiotic with adjusted dosages to reduce the side effects, or employing a patient-centered supervised multi-drug regimen with psychosocial support, or providing experimental third-line antibiotics without direct supervision, or relying on periodic symptom-based adjustment to the medication regimen.
A. C.
It's C, employing a patient-centered supervised multi-drug regimen with psychosocial support. The second line MCQ. A mother brings her child to a clinic for cough evaluation. AI-based analysis of the cough suggests potential tuberculosis. What could be the next step? Whether start treatment immediately, perform a chest X-ray and sputum examination, prescribe antibiotics for pneumonia, recommend home rest and follow-up in 2 weeks, or initiate contact tracing before confirming diagnosis.
B.
Yes, it's B, perform a chest X-ray and sputum examination. Last MCQ. A public health initiative focuses on rapid molecular test for diagnostic TB. What advantage do these tests offer compared to the traditional method? Whether reduced treatment duration, higher sensitivity in latent tuberculosis detection, faster result with drug-resistant identification, lower cost than sputum culture, or complete prevention of TB transmission?
C.
Yes, it's C. Faster results with drug-resistant identification. Here is the key of the MCQ. This is our YouTube channel by the name of Community Medicine, King Edward Medical University, where all the presentations are uploaded here. You can simply go there and watch any presentation given by the postgraduate residents of King Edward Medical University and Institute of Public Health. And thank you very much for today's presentation.